Well now, let's talk about Sinequan. You might know it as doxepin, a name that might sound familiar to some. It's been around for a while, like a trusty old truck that has seen many roads and weathered many storms. We call it a tricyclic antidepressant, a term that might seem complex but is quite straightforward. That just means it's in a certain family of medicines, known for their unique structure and function. These medicines work in your brain, targeting specific areas to bring about change. They help balance out chemicals that affect your mood, making sure everything is in harmony. Sinequan is like a key that fits into certain locks in your brain, unlocking potential for better mental health. These locks are called receptors, and they play a crucial role in how you feel. By attaching to these receptors, Sinequan can help improve your mood and sleep, providing relief from the weight of depression. Now, it's important to remember that everybody's different, and our brains are as unique as our fingerprints. What works for one person might not work for another, and that's perfectly okay. That's why it's crucial to talk to your doctor, who understands the nuances of these treatments. They'll know if Sinequan's the right fit for you, guiding you towards the best path for your mental health journey. So you might be wondering, what exactly does Sinequan do? Well, it's mainly used for depression, but it can help with other things too, like anxiety, insomnia, anxiety and depression with alcoholism, and as a topical cream for conditions like atopic dermatitis and other skin conditions. Think of depression like a heavy rain cloud. Sinequan is like a little bit of sunshine peeking through. It might not make the cloud disappear completely, but it can make it feel a little lighter. Sinequan can also help with anxiety and trouble sleeping. Sometimes those things come along with depression. It's like they're all holding hands, unfortunately, but Sinequan can help you get some rest and peace of mind. Now listen up close because this is important. We're diving into something that could be crucial for your health and well-being. Sinequan has what we call a black box warning. This isn't just any warning, it's the most serious one that the FDA can issue for a medication. That's the most serious warning a medicine can have. It indicates that there are significant risks involved, which you need to be aware of. It means there's a risk of suicidal thoughts or actions in young adults and children. This is particularly concerning for those who are already vulnerable. Increased risk for ventricular arrhythmias like QT prolongation or torsades. Risk should be balanced with the clinical need for this medication. Monitor client closely while in care and only use under direct supervision of a medical professional. Advise patient, family, caregiver to also monitor the client's mood and behavior closely and report any changes in mood or behavior. It's like a flashing red light telling us to be extra careful. This warning is there to make sure we don't overlook these serious risks. This doesn't mean Sinequan is bad. It has its benefits and can be very effective for treating certain conditions. It just means we gotta be cautious. Always weigh the benefits against the risks and make informed decisions. If you're on Sinequan, it's important to talk to your doctor right away if you have any thoughts of hurting yourself. Open communication is key. We want to catch those feelings early on. Early intervention can make a significant difference in managing these risks effectively. Side effects, what you might experience. Like any medicine, Sinequan can have some side effects. Now don't let this scare you. Not everyone gets side effects and they're usually mild. It's like a little bump in the road. It might slow you down a bit, but it won't stop your journey. Some common side effects include dry mouth, blurry vision, constipation, and dizziness. These usually go away on their own after a while, but if they're bothering you, talk to your doctor. They might adjust your dosage or suggest another medication. Dosing and interactions. Finding the right balance for you. When it comes to Sinequan, dosing by diagnosis varies, but we always start low and go slow. This means beginning with a small dose and gradually increasing it. Lowest dosage possible by diagnosis treatment. Mild depression, 25 milligrams a day. Mild to moderate depression, 75 milligrams a day. Anxiety with alcoholism, 75 milligrams a day. Insomnia, 6 milligrams 30 minutes before bed. Atopic dermatitis, 5% cream 4 times a day. It's like baking a cake. You wouldn't dump the whole bag of sugar in at once, would you? You add a little at a time to get the perfect sweetness. Your doctor will figure out the best dose for you. They consider your medical history, current health, and how you respond to the medication. And remember, It's important to tell your doctor about all the other medicines you're taking, even vitamins and herbs. This helps avoid any potential interactions. Some things don't mix well with Sinequan. Certain medications can cause adverse effects when taken together. This drug is contraindicated for patients currently taking literally anything. But here's y'all a list. Thyroid supplements, antihypertensives, antidepressants, such as MAOIs, SSRIs, SNRIs, cimetidine, or other drugs in treatment of irregular HR. St. John's wort, talazimide for hyperglycemia, CNS depressants such as opioids, alcohol, marijuana, other sleep anxiety medications, muscle relaxants, drugs metabolized by the enzyme P4502D6, antihistamines, and grapefruit juice. These medications' interactions can result in adverse effects like serotonin syndrome. It's like trying to mix oil and water. It just doesn't work. They remain separate, just like some medications. So be sure to keep your doctor in the loop. Always provide a complete list of what you're taking to ensure your safety and well-being.